Well, with our infertility patients, the first thing they're going to do is learn how to chart their cycles using the crate model system, because this system tells us so much about different aspects of their cycles, their fertility cycles and their menstrual cycles, including things that might be abnormal, because it's a standardized approach. It gives us feedback. These are biological markers that feed back to us, and we can't do our work literally without these patients becoming a partner with us in all of this. So when they start charting their cycles, they see things they've never seen before, never understood before. And frankly, they get excited because this is something special to them. Somebody actually took the time to teach them about this. Once we get that information, which is usually 6 to 8 weeks probably, then we do a thorough hormone profile of their cycle. We do an ultrasound series to determine if they have one of 6 or 7 different ovulation disorders. And we do what's called a laparoscopy. A laparoscopy is a minor surgical procedure where we put in a scope and we can look for endometriosis or pelvic adhesions or whatever the conditions might be. Now, you asked about a hormone laboratory. Well, this hormone laboratory that we have here is the only one in the country, if not the world, that can tell you exactly whether or not the hormone level drawn on a particular day of the cycle is, whether that level is normal or not, because we've put a lot of time and energy into standardizing and studying what is normal and tying it into the cycle, because one of the things that all women know is that their hormone levels are not the same from day to day to day to day. All doctors even know that, but doctors haven't the clue as to when to draw their blood to get a blood level, because they don't use a system like we use, which is the crate model, which will tell you exactly when to get that blood drawn and to evaluate it in a way. So we're not searching for needles and haystacks here. We're getting really targeted results, if you will. Same thing with ultrasound studies. We've actually studied more spontaneous ovulations by ultrasound than any place in the world. We've probably 3,000 women now have been through an ultrasound series here. And we've been able to define from that the various ovulation defects and abnormalities that one can see in infertility or a miscarriage. So it's pretty helpful and an extremely helpful diagnostic tool for us. So all of that takes about 4 months. And when you go from beginning to end, you've got an answer as to what the problems are most of the time. You don't have all the answers, but you've got a good handle on it. And now you can begin to treat that. You cannot tell anybody when they're going to get pregnant. That's unfortunately still one of these questions you can't answer, because it could take a month or two, it could take a year or two. You just don't know. There's so many things yet about infertility we don't know. What we do know is that the per woman pregnancy rate, that is to say, if an individual woman comes to us, what are the chances that she'll get pregnant eventually and have a baby, are anywhere from 1.5 to about 3 times higher than with an IVF clinic.
Well, I think that NaProTechnology is good science. I mean, when I first read about Dr. Hilgers and looked down his website, I thought, well, what does he do that's so revolutionary? And I was asking these questions as a college student. And so when I really found out the answer, the true answer is that he searches for the underlying cause and treats it. And I was a little bit confused because I thought, well, isn't that what physicians do? I thought, what he does is really just the common sense approach to treating infertility.
Probably one of the things that, more than anything else, that we see is these patients who have been to multiple doctors. The doctors almost ignore what's wrong with them. It's almost like they don't believe them when they say all this pain or whatever it might be, or fertility issues. And their focus is only on sending them to the IVF doctors. It's like that's the only treatment available. And so eventually they find out about us after they've been through all of this pretty negative history. It can go on for years and years and years, actually. And then when they finally get here and we find out what's wrong with them, they ask me, why did my doctor not find this? And we have to tell them it's because they didn't look. And maybe even if they looked, they wouldn't know what they're looking for.
As a woman, I had, had many experiences where nurse practitioners or doctors at, say, student health in the college that I attended had tried to put me on the birth control pill for no other reason than to prevent pregnancy. And so, I understand what a lot of my friends and what I myself have gone through, in that, there's kind of an agenda behind putting women on the birth control pill, because there's this attitude that the doctor knows best, that you don't have self-control, you can't make the best decisions for yourself. And so I've always found that attitude to be very demeaning and condescending. And so I think that the work that we do here at the Pope Paul VI Institute and the use of NaProTechnology, we develop a partnership with our patients, and we educate them and inform them so that they can make their own decisions. And so, I really feel like we're doing what's best for a woman's health, and we're not trying to, force anything upon them, and we're just looking for the underlying causes and treating them.
The tragedy is that they can't get this other places. They can't go to their local doctor in New York, or their local doctor in Los Angeles, or their local doctor in Texas someplace. I mean, they come from all over. They come from other countries, even from Africa, from Italy, from Ireland, from Australia, from Mexico, these places, and none of this is available. When you're dealing at the beginning of life like this, and where it means so much to the people that you're working with, the whole staff here at the Institute is just uplifted by this tremendously, because they're part of a team of people who are working so well together, and so much to be of assistance to these patients.
There's so many stories in the past where I felt this incredible act of, we really met at a level with this person and helped them a way that they would have never been helped ever before. And specifically, I can think of a young girl, and she was really quite amazing. She was only 19, and she was married. She had gotten married to her sweetheart, I think probably out of high school, and had just had her first baby. And after her first baby, went into a severe case of postpartum depression. And, her doctors were unable to help her, or what they were offering her were a lot of medications that would force her to have side effects and stop her breastfeeding, which she did not want to do. And she, contacted the Pope Paul VI Institute, which, usually happens because people have heard of us and, I've heard of this place that really could help you. And so she did. And she was so mature, and she just really was desperate for help because she wanted to be able to take care of her newborn child. And when we talked about the symptoms that she was having and went through that, and I said, I really think we can help you. And I think we can help you quicker than you think is possible. And we have this great, great treatment for postpartum depression that Dr. Hilgers started years ago, and we still implement. And we were able to get that going for her within, probably 12 hours, which was amazing because she was across the country. And I called her the next day to talk to her, and she said literally within 2 hours after receiving her treatment, that it was like a dark cloud had lifted. It was a total reversal of her symptoms, and the depression and the anxiety and the feelings that she was having, which were very severe at that point, had completely lifted. And when you hear that, you kind of sit there and you're in awe by the fact that, wow, something that simple, which it is, could help somebody. And it's also at the same time benign, not harmful to her, not harmful to her baby. And, that was really, and she was so, gracious then. Just thank you so much for helping me. Nobody else was really there for me. So that's an experience that I think will always take with me. And I've had many postpartum depression patients like that have felt so much better on the treatment that we've done for them.
A number of years ago, I had a patient who came out here from Portland, Oregon, who had really severe pelvic pain. She was told that she'd never get pregnant without in vitro fertilization, test tube babies, but she didn't want to do that. And so she found out about us, and she came all the way out here to have us evaluate her problem. We found extensive endometriosis. She underwent a 6-hour surgery, and subsequent to that, she's had 2 babies. And to see the joy in her face and to talk to her, and she's helped us in many other ways since, but she had, when she came out here, it was just out of faith. She didn't know much about us yet, but we got to know each other, and it's this sort of story, this sort of thing that happens that lights a fire under people, because this woman had been ignored by doctor after doctor after doctor in spite of all the pain that she had. And she doesn't have any pain anymore. Her endometriosis is gone. She's had 2 babies. It's a tremendous success, and that's just one example, but they're all over the place. I did a laparoscopy on a patient this morning who had been here about 3 or 4 years ago, and she had endometriosis too, and with a laser, we lasered it, got rid of it. She was pregnant 6 weeks later.
Right now, we have a patient coming to us, and she experienced 10 years of infertility and had been to many, many doctors before she came to us. We worked her through all of our recommended evaluation and diagnosis and treatment. And she was pregnant within, I think, the first 6 months after all of her treatment was completed. And I saw her in that first visit after she found out she was pregnant. And it was still just this moment of, I just can't believe I'm here. I can't believe I'm sitting here, that I'm actually, pregnant and carrying this child, because I spent the last 10 years never thinking this was ever going to happen. And what a joy that is, because when you're faced against what you seem as insurmountable or impossible, and someone comes along and says, well, look, nobody found this problem, and you just need someone to really look down deeper and find out what's wrong and treat this, and there's a chance that you will have a baby. And for her, that chance came true. And again, she's now close to delivering her baby, and it's still, I think, kind of one of those, is this really real? Can you pinch me? Because, when you wait that long for a baby, it's a pretty incredible thing to be sitting there and you're like, I'm moments away from actually having this dream come true.